This is an ultrasound study of a female pelvis patient with a history of oligomenorrhea for the last 2-3 months and dysmenorrhea as well. She is a married female, has 4 kids, no history of surgical intervention. Now we see that this is the longitudinal section of the uterus. This is the uterus, this area, and this is the longitudinal section of the uterus. This is the endometrial canal. It's in the mid-cycle, and this is the anterior myometrium, the posterior myometrium, the fundal region. It's normal. There is seen an evenly echogenic area with small amount of fluid at its lateral margin. This is the lateral margin, and if you see that the cervix is dilated to approximately 4 centimeters. Now the cervix is dilated by up to 4 centimeters. This is the anterior lip of the cervix, and this is the posterior lip of the cervix, this area, and this is the cervical canal. So we see collection within the cervical canal. Most probably this is the bleed, and it is being confined at its lateral margin by the vagina. This is the vagina, and at its medial end it is being confined by the internal os. So between the internal os and the vagina we see collection of ecofil fluid, which is possibly nothing. It can be nothing but bleed, collection of bleed with small amount of fluid, and this bleed or collection is elevating the anterior lip, whereas depressing the posterior lip of the cervix. Okay, now let me show you this on real time. Here you see now, this is the vagina. You see, this is the urinary bladder, this is the vagina layer, and this is the collection of fluid with echos. You see ecofil fluid or a bleed, elevating the anterior lip of cervix. This is the anterior lip of cervix, this is the posterior lip of the cervix, and from here onwards we see that the uterus is normal. There is no finding except now. Can it be a cervical fibroid? Will be a question, but if you look at the consistency of the of this ecofil fluid, you can see this is small calcification giving posterior shadow within this fluid. So this is in fact, now this is the transfer section. Okay, let's see in the transfer section. We do see a small amount of fluid in the pelvic cavity. This is small amount of fluid in the pelvic cavity, and this is the transfer section, and this is the ovary, right ovary. This is the transfer section, that of the body of the uterus and the fundus of the uterus. You can see that the endometrial canal is in mid-cycle, and it is clear, central. And when I move the probe posteriorly, now you will see that there is the same consistency, and you can see small movement as well. You see, this is the calcification giving sharp posterior shadow, and small amount of fluid is also seen in this transfer section. So this is the cervix. You can again see that the cervix is containing collection and the anterior. This is the anterior lip of the cervix, the posterior lip of the cervix, and this is the collection. This area is the collection. This is the transverse section. This is the urinary bladder. All this. I have to give some pressure to get this view. And this is the transverse section of the cervix. This is cervix. This is the posterior lip of the cervix in transverse section, and this is the collection. Now this is in fact the uterus from a different angle. You can go of the uterus. This is all uterus, and this is the fluid that you can see in the pelvic cavity. Small amount of fluid is seen. So this is a case of collection in the cervical canal that elevates the upper and posterior, elevates the anterior lip of the cervix. Let's see a magnified view. Now in this magnified view I am able to get the, you see this is the vagina, this is the internal os, there is fluid, clear fluid over here, and this is all collection. This is the anterior lip of the cervix, this is the urinary bladder, and internal os it is, and it measures approximately. So this is the body of the uterus. Fundus is being cut off in this view. This is the endometrial canal at the body of the, and this is the cervix, collection, vagina. So it is bounded laterally by the vagina and medially by the os, internal os. Rare thing to see in married Paris female, but as I saw, I grabbed the opportunity to make a video for you. This is the small amount of fluid seen in this region. And this is the magnified view of this collection. In the collection we do see some tiny, shiny echogenic areas. As such, the whole length of the uterus is, including the collection, 10.5 by 4.3, and it will be considered as within normal. So this is our case of the day. Thank you very much. Now let's study the possible differentials for this case. That you see that this point, this area is the uterus, endometrial canal, anterior lip of the cervix, posterior lip of the cervix, and this is the collection, and this is the fluid. Well, this can be, now what can be the possible differentials in this case, given the fact that you do not have any lab profile or any other investigative procedure provided to you, except only the one I have reported to you, I have informed you about. So this can be a polyp, and this can be endometriosis, that of this cervical region, and this can be a fibroid. So these are three possible differentials: either a clot formation, either endometriosis, it can be a polyp, and it can be a fibroid. So further investigation is required in this particular case. Thank you very much.